Research Institute, breaking the wall of brain cancer treatment.
Brain cancer cannot be prevented. There are very few risk factors for developing brain cancer. And if you do get brain cancer, it is likely to be glioblastoma, the most common and most aggressive brain tumour. By the time glioblastoma is diagnosed, they have often reached a formidable size and are affecting normal brain functions, resulting in headaches, seizures, and memory loss. Glioblastoma patients will have surgery to remove as much of the tumour as possible, followed by grueling radiotherapy and chemotherapy. Despite this, the median survival for glioblastoma patients is 12 to 15 months. Just 5% of patients survive for 5 years. This is because some of the glioblastoma cells are resistant to radiotherapy and chemotherapy. These resistant cells survive and then thrive, forming a second tumour. 90% of glioblastoma patients develop a second tumour in the brain within 7 months of treatment. This is what is killing the patients. Our current treatments are selecting for these resistant cells. These resistant cells are responsible for tumour recurrence, and in order to stop this, we need to target these cells directly. We have shown that these resistant cells have certain characteristics which help them survive and then grow and spread throughout the brain. We could develop drugs to target these cells, but there is a further 2 problems. One is the blood-brain barrier, which drugs must be able to cross and reach an efficacious concentration in the brain in order to kill the resistant cells. The other is the drug development pipeline, which has very high rates of attrition and is prohibitively expensive. In order to get around this, we repurpose drugs which are already used in the clinic to treat a range of other conditions. These repurposed drugs are known to cross the blood-brain barrier and are cheap, off-patent medications. We know that some of these drugs can directly target these resistant cells. And we are currently in the process of testing these drugs for their anti-tumour actions in glioblastoma, both in the lab and in a clinical trial. Brain cancer cannot be prevented, but we can improve brain cancer treatment.